Okay, this patient has come to us from Sudan. He had a previous bilateral open varicocele surgery and then recurrence in the left side, and he had a left-sided embolization. After all of these procedures, he had a recurrence again, and he found us from internet for our Istanbul varicocelectomy technique. In this technique, we dissect out and take out long segments of veins. We don't want the veins to remain inside and to wait for them to disappear by themselves. So in this operation, previously the most important part of the operation is understanding the anatomy of the varicocele and understanding the recurrent veins, the locations of the recurrent veins. And we did a Doppler ultrasonography before the operation and find out that he had one big external vein and one big internal vein. And before the operation, we did a Doppler ultrasonography and we find that there was a big external vein in the left side and a big internal vein in the left side. And in the operation, it is easy to find the external veins, and everybody can easily remove the external veins. And usually they don't need any microscope. They are visible by naked eye and they don't contain any significant artery around themselves, and they can be dissected. Nobody is dissecting out them as we do, like long segments, but when we dissect, it is easy. But for internal veins, it is very difficult to differentiate the arteries from the veins because they are in close contact. They are just follow themselves side by side. So using microvascular Doppler device is very important in this step. We use this device and we find the arteries and the veins. Arteries always has a pulsating sound, and sometimes the vein has a deep C sound, deep wave sound, wavy sound. We call it venous sound, and we see it mostly in the recurrent cases. So in this patient, in the left side, it was easy to find the in external and internal veins, but in the right side, the veins and the arteries were just mixed into each other, and it was very difficult to differentiate arteries from veins. And our Doppler device, microvascular Doppler device, worked very well, and it showed us the arteries and recurrent veins. So we could dissect the veins easily and ligate them. We couldn't get them out as long segments as in our classic operation, but in such cases, sometimes if they are stuck to each other, we just take out the external vein and ligate the internal veins. But we don't just leave them behind and wait for the swelling of these veins that happens in the testicular part. And when they are swollen, we ligate them again and again, and we try not to leave behind any swollen parts of these veins. So I think we ligated here 4 different veins, but we ligated them at least 3 times. So there are many ligations inside, and we didn't leave any swollen vein behind. So as I said, there are many patients who have laparoscopic surgery, embolization, classic conventional varicocelectomy, and the recurrence rates are unfortunately higher than they are estimated in the literature. They are at least 30% for all kind of operations, but this is why we do this Istanbul varicocelectomy technique, and we take the veins out, and we don't want to leave any vein behind to disappear by itself. This is the way we operate. Thank you.